In other news today, the Human Sciences Research Council has released its 6th survey on HIV in our country. These studies found that KwaZulu-Natal still had the highest HIV prevalence rate in the country. However, more people living with the virus have a suppressed load. In other words, they can't transmit the virus to someone else. Karinda Jagmohan has more.
As we approach World AIDS Day, this is an important briefing to discuss the state of the country just in terms of the prevalence of HIV and AIDS. And of course, the HSRC at the forefront of the current study, the 6th wave of the survey. I'm joined by the director, Professor Kangelane Zuma. So thank you so much for your time. The 6th survey that we see in our country, what are some of the glaring statistics, especially for KwaZulu-Natal?
What we see is that as a country, we've done very well in dealing with the HIV epidemic. We're turning a 10, we're making a good 10, but the results show that we are not there where we want to be. There is still a lot more that we need to do to get to where we want to be. For example, if you look in terms of the proportions of people that are virally suppressed, which is what we want. We want everyone to be virally suppressed, because if you are virally suppressed, you are less likely to transmit the virus to the next person. Is the best way to reduce HIV transmission. What we see is that even though KwaZulu-Natal is leading and has been leading for a number of years in terms of the proportions of people that are living with HIV, this is an unfortunate statistics or a record that KwaZulu-Natal has been carrying. But the fortunate part is that KwaZulu-Natal is also among the leading provinces. KwaZulu-Natal, Mpumalanga and Free State are the leading provinces in terms of the numbers of people that are virally suppressed. Meaning that even though they have the large population of people living with HIV, they also have the largest number of people that are virally suppressed who are less likely to transmit the virus. And that, I think, it's a good statistic to note. However, we need to work even harder to deal with the other proportion of people of about 14% about 16%, if I'm not mistaken, in KwaZulu-Natal, that actually is still not virally suppressed. Because that is the pool that if we do not work hard around that, they will continue transmitting the virus. So we need to deal with that group again by making sure that they are put on treatment. They are virally suppressed. And the communities, as we have seen, KwaZulu-Natal and other provinces, young girls, or not only young girls, boys and girls, they are less likely to be virally suppressed. And most of them did participate in the study. There were most ones that participated in the study. But viral suppression is the lowest in that group. So which means we need to support young boys, young girls to get to the clinic, get tested. If they test positive, they must be given treatment. The families, the clinics, everyone around at school, we must support young children when they are living with HIV. They are put on treatment. We know the challenge that we have with stigma. We need to deal with that. Communities must support young people, because obviously for a child to test positive, it is trauma. But families can make that trauma bearable. We need to support our young children.
Absolutely so, sir. In this media briefing, you spoke about some historical factors that might contribute to the eastern part of the country having this high prevalence. Can you briefly describe some of these factors?
And we've seen in a research that has been done for a number of years in how HIV is transmitted from urban areas first into the rural areas. And a big part that was contributing, that we saw a number of years on research that was done by a number of research institutions. For example, migration, migrant work, oscillatory migration from urban areas to rural areas to urban areas. Those are the processes that actually contributed for a number of years in the increase in HIV prevalence. If you look at KwaZulu-Natal, Eastern Cape, Mpumalanga, these provinces had actually a lot of oscillatory migrants that were contributing.